2 out of 5 people are struggling with fatty liver disease. And why this is so important? Fatty liver has been strongly associated with serious conditions like diabetes, heart attack, stroke, polycystic ovarian syndrome, and so on and so forth. From the statistics, either you or someone close to you may be affected by fatty liver disease. The good news is fatty liver is totally treatable, and in this video I'll share some practical tips that can help you reverse your fatty liver in just a few weeks. I'll also discuss the role of supplements, the best diet regimen, and foods to avoid to achieve the best results. And who am I? I'm Dr. Sina, an ER doctor, which handles everything from trauma to COVID, heart attacks, strokes, and more. In this channel, I provide you evidence-based medical tips to help you lead a healthier lifestyle. So, before we dive in, please hit the thumbs up and subscribe for more helpful content. What is fatty liver? Fatty liver means that fat has been accumulated in your liver, and this is definitely not a good thing. If left untreated, it can lead to liver failure, and then you may end up on a transplant waiting list. The problem is, sometimes when you visit your doctor and they tell you that you have fatty liver, they may only suggest you follow a diet, but they don't provide specific guidelines or may just passing by. There's also a common misconception that only people who are overweight are at the risk of the fatty liver. In fact, I regularly see fit and young people with fatty liver in my practice. So, even if you are at a normal weight range, it's important to check your liver health. The most important step in treating fatty liver is cutting down on sugars and starch as much as possible. Surprising, yeah? Fatty liver is not caused by a high-fat diet. The real culprit is carbohydrates. Carbs come in 2 main types: simple carbs like sugars and complex carbs like starch and fiber. Carbs are the body's main source of energy, but when we eat more carbs than what we need, the excess glucose gets stored as a fat in our cells. This is how carbs can contribute to fatty liver. So, if you have fatty liver, the first step is to reduce your carbohydrate intake, especially simple sugars. Let's take a closer look at what foods to avoid. Number 1, simple sugars. These are the most harmful. While it's good that you are cutting down your candy and cake intake, it's not enough. Sugary drinks, processed foods, or even some fruits can spike your blood sugars. Yes, fruits contain fiber, but they also contain sugars, so limit their intake. Opt for vegetables like cabbage, lettuce, cucumber, and tomatoes for fiber instead. Number 2, fruit juices. Never drink fruit juices. It's loaded with sugars, which contributed to fatty liver. Number 3, honey. One of the most harmful things to your liver is honey. I know. You've heard a lot about magical effects of honey. There's a lot of claims, especially in traditional medicine. But despite the health claims about honey, it's high in sugars and can worsen your fatty liver. You know, there are always people who cut down sugars. They don't add sugars to their coffee or tea, but instead they start to use dates, raisins, and dried mulberries. They are high in sugar too. While they seem healthy, they should be eaten in moderation. The next culprit is starch. Starch like rice, bread, pasta, and potatoes also contribute to fatty liver. Starch is made of glucose molecules, which, when digested, raises your blood glucose level. If you have fatty liver, minimize starchy foods. Here is an interesting tip: resistant starch. This type of starch resists digestion in the small intestine, which means it doesn't spike your blood sugar. You can turn regular starch into resistant starch by cooking and then cooling foods like rice, potato, or pasta overnight. When you eat them the next day, they have more resistant starch, which is healthier for your liver. However, this doesn't mean you can eat them unlimitedly. Moderation is the key always. The next step in treating your fatty liver is weight loss. If you're overweight, losing just 10% of your body weight can significantly improve your fatty liver. For example, if you weigh 90 kilograms, losing just 9 kilograms can make a big difference. Weight loss can be achieved through a combination of a diet and physical activity. Regular exercise is critical for reversing fatty liver. Aim for at least 115 minutes of moderate intensity exercise per week. This can be broken down into sessions, 3 sessions, 5 sessions throughout the week, but make sure it gets your heart rate up. Simply walking around the mall doesn't count as exercise. Now it's turn to go through with supplements. There are supplements out there claiming to help with fatty liver, but how reliable are they? Some supplements have been scientifically proven to help, including omega-3, vitamin E, ginger, garlic, curcumin, which is from turmeric, milk thistle or silymarin, and probiotics. However, these supplements work best when combined with a proper diet regimen and regular physical activity. You cannot just take supplements and expect your fatty liver to magically improve. Also, be aware of potential interactions with medications. For example, garlic can thin your blood, which is dangerous if you're taking blood thinners like warfarin or clopidogrel. Always consult your doctor before starting any new supplements. In summary, the key to reversing fatty liver is to focus on a diet low in sugar and starch, maintain a healthy weight, and stay physically active. Supplements can support your efforts, but they're not a replacement for a healthy lifestyle. If you found this video helpful, give it a thumbs up and hit the subscribe button. If you have any questions about fatty liver or any other issues, comment me below. I will be there to answer you. Take care of your health because it's the real wealth.